Hello, I am Professor Dr. Ligia Russo from University of Craiova, and we are partner in the Erasmus Plus project named Clinical Care for Electrical Stimulation in Physiotherapy and Rehabilitation. One of the topics in the Module 2 of this course is currents used for electrical stimulation. I want to present you some aspects about magnetic field stimulation. What about this? What is a magnetic field? Magnetic field is produced by an electric current or electric field. The magnetic field produced by an electric current presents the same physical parameters characteristic of the generating electric current. So, before apply this method in electrostimulation, is need to know more about what means magnetic field. Magnetic field therapy is a method of treating inflammatory conditions and reducing the associated pain through the action of a pulsating or static magnetic field on different parts of the body. Electromagnetic fields are generated by low-frequency currents, means 50 to 100 Hz. This treatment is known based on knowledge about magnetic fields, and it was used since the 16th century, when Paracelsus used magnets to stimulate the callosin fractures. Later, in 1845, Faraday discovered magnetism and the law of electromagnetic induction. And in 1902, the first studies on the biological effects of magnetic fields are published. So, it is a long period that discuss about the role and the effects, the advantages of use the magnetic field. Recent studies have demonstrated the biological effects produced by pulsating, interrupted, magnetic fields in particular. The continuous magnetic field does not produce adverse effects on the human body. For this reason, the whole organization of human allows the application of the continuous magnetic field of 2 to 3 Tesla on the human body. A bracelet with magnet has 21,130 millitesla. Clinical tests have shown that magnetic therapy does indeed have the effect of reducing pain. Why? Because magnets penetrate deep into tissues and create a magnetic field that energizes, alkalizes, and oxygenates, improving the immune system function and the body's capability. Mechanism of magnetic field stimulation. The action mechanism of magnetic fields on the body is not fully known. It is considered to be similar to that of electromagnetic radiation, short waves. The production of energetic changes at the level of cell membranes with increased membrane diffusion and increased cellular metabolism. This is the first mechanism. The second is stimulation of vascular nerve formation. And this is very important if we speak about the indication and contraindication. Stimulating the growth of reparative granulation tissue in wounds. Stimulation of collagen production at the cartilage level. Stimulation of cellular oxidative enzyme activity, mixoxidase, peroxidase, with a better use of oxygen, and this increase the use of oxygen to the tissue level, which is very important if you speak also about physical exercise associated with electrical stimulation. The magnetic fields penetrate deep into the tissues, creating a magnetic field stimulation that improves the function of the immune system and the body's healing capabilities. Magnetotherapy can be applied continuously, having a sedative effect intermittently, rhythmically, or without any rhythm, and in this case having a general stimulating effect. What are the beneficial effects of the magnetic stimulation? Are four directions that could be taken in consideration and that have been demonstrated. Central and vegetative nervous system, blood and lymphatic circulation, cellular metabolic processes, the neuromuscular system, especially phasic muscle. And now we have to discuss for each. Regarding central and vegetative nervous system, continuous magnetic field stimulation generates sedative and parasympathetic effect. Interrupted magnetic field stimulation generates excitatory and sympathetic effect. Frequency below 10 Hz, the effect is vagotonic. 50 Hz frequency, effect of sympathetic. The second, the blood and lymphatic circulation. The interrupted magnetic field stimulates the development of neoformation vessels and the kinetics of lymphatic vessels. The third, cellular and metabolic process. Continuous magnetic field stimulate anabolism. Interrupted magnetic field stimulate catabolism. The neuromuscular system, especially the phasic muscles, the continuous magnetic field stimulation increases the rhythmicity of the discharges in the motor neurons with the increase of the recruitment phenomenon. The interrupted magnetic stimulation, the contract of muscles. Which is the effects of therapy with low frequency? We have two forms, unmodulated continuous forms, which has sedative effect, sympatholytic effect, trophotropic effect. Interrupted forms, which have excitatory effect, sympathetic effect, ergotropic effect. The choice of forms of application, continuous or interrupted, depend on the basic condition, constitutional type, individual neurovegetative reactivity, and the biorhythm of the subject. And the main effects are acceleration of fracture callus, stimulation of wound healing, sedation and analgesia, microcirculation stimulation. But are some rules and some principles for apply the treatment with low frequency magnetic field stimulation. Which are the rules? The treatment so far should be made of insulting material. It is recommended that the patient remove metal objects from the body. Avoid placing the coils in the vicinity of the patient possible metal implants. The application of treatment to patient with pacemaker is strictly prohibited. The patient sits in supine position, dressed loosely. Cephalic extremity orientated to the north. The arousal on the cervical and lumbar coil is orientated towards the cephalic extremity. The locating coils are positioned according to the poles marked with the respective symbols, north to south, on the treated region. Application technique. Magnetic field stimulation devices have applicators that sit on treatment areas or coils, cervical and lumbar, that are attached to a treatment bed. Applicators or coils are applied over the patient clothing. Modern devices can also be applied to areas with metal implants, interrupted magnetic fields. Distance of the least 1 meter is indicated between magnetotherapy device and other device. And for this reason, it has to be very important to be careful about the manual instruction of the device. Indication of low frequency magnetic field therapy are a lot of indication. Could be used in wide range of diseases or problems such as rheumatic disease, means chronic degenerative rheumatism, abarticular rheumatism, tendonitis, myalgia, myoglosis, inflammatory rheumatism, rheumatoid polyarthritis stage 1, 2, spondylitis, psoriatic arthritis, post-traumatic sequelae, wounds, contusions, muscle hematomas, sprains, musculotendinous ruptures, post-fracture, fracture consolidation. Neuropsychiatric disorders means neuroses, neurovegetative dystonia, hemiplegia, paraplegia, Parkinson's disease. Cardiovascular disease. And here we have a lot of indication. Functional peripheral vascular disease, Raynaud disease, Raynaud syndrome, acrocyanosis, organic peripheral vascular disease like thromboangiitis obliterans, atherosclerosis obliterans of the limb, diabetic arteriopathy, cerebral arteriosclerosis, arterial hypertension, stage 1 and 2 of lymphedema. Respiratory disease, bronchial asthma, chronic bronchitis. Digestive disorders, chronic gastritis, chronic gastroduodenal ulcer, biliary motility disorders. Endocrine disorders, type 2 diabetes mellitus, hypothyroidism. Gynecological condition, dysmenorrhea, non-specific chronic metroanexia, non-specific chronic cervicite, climax and preclimax disorders. Neurologic condition. Also here we have a lot. Spasticity after stroke, pacemaker waivers, hypotensive syndrome, advanced cerebral arteriosclerosis, hemorrhagic condition, severe hematological disease, anemia, malignant tumors, active pulmonary, extrapulmonary tuberculosis, infection disease, febrile condition, insufficiency, renal, hepatic, cardiac, pulmonary, psychosis, epilepsy, and pregnancy. All of this represents contraindication of low-frequency magnetic field stimulation. This has to be in consideration by physiotherapists. I said you that we have rules, but we have principle of the application of therapy through low-frequency magnetic field stimulation. Depending on the condition and the objectives pursued, both the form of application and the frequency of work are chosen. And here some recommendation that we have is the duration of the session varies, depend on the disease, but could be 20, 30, 45 minutes. Numbers of session is large, 12, 18, 22. A rate of application is daily. Some few idea and words about transcranial magnetic stimulation. It is a non-invasive form of brain stimulation in which a continuous changing magnetic field is used to induce electrical current in a specific area of the brain through electromagnetic induction. An electric pulse generator or stimulator is connected to a magnetic coil, which in turn is connected to the scalp. The stimulator generates a changing electric current inside the coil that induces a magnetic field. This field then causes a second induction of inverted electrical charge within the brain itself. In 1919, the first research studies using brain scanning to see images of the brain deepened the state of the brain of depressed people. This study showed that the left side of the prefrontal cortex, the brain region, was underactive in depression, leading the researchers to wonder if they could use transcranial magnetic stimulation to increase the afferent of neuron in this brain region. For example, scientists found that applying transcranial magnetic stimulation to a certain part of the scalp caused the hand of a participant in the experiment to tremble. In this way, the part of the brain responsible for controlling hand muscle movement was discovered. And you can see in the figure 1 the position of transcranial stimulation. Transcranial and peripheral magnetic field stimulation procedures in chronic pain. How we know the chronic pain is today in a large accept to be in increased incidence, and this chronic pain generate a lot of discussion, a lot of approach regarding assessment and treatment. The mechanisms of activation and regulation of pain perception are extremely complex and include bidirectional communication between peripheral receptors, the immune system responsible for inflammatory process, the endocrine system, and the nervous system. In the case of chronic pain, adaptation mechanisms appear both at the level of the peripheral nervous system, sensory and motor peripheral nerve, and central cerebral circuit that end maintaining several vicious cycles. Magnetic stimulation is addressed to patients with lumbago, cervical pain, headache, migraine, facial pain, neuropathic pain, chronic pelvic pain syndrome. Some approach through magnetic stimulation session consists in combining this technique with those of TCMS, peripheral nervous system, in a manner customized to the characteristic of each individual patient. The applied therapeutic strategy is established by the coordinating physician after a specific functional evaluation of both neuromuscular imbalances and secondary complications of chronic pain that participate in maintaining the vicious circle. But let's see what are the advantages of magnetic field stimulation as treatment method for patients with chronic pain. We present it provides direct access to the peripheral nervous system. By activating the motor nerves, the contraction of different muscle groups is obtained, and by using several frequencies, a different recruitment of muscle fiber is obtained. It provides direct access to the central nervous system, having the effect of modulating brain circuits, both those involved in pain processing and those involved in emotional and cognitive functions. It significantly increases the chance of getting out of the precreative vicious circles by combining the effect of peripheral and central nervous system modulation. Acts directly on the neurophysiological mechanism responsible, at least partially, for the pain syndrome, acts directly on the cause. It does not create addiction. It can be associated with other interventional or pharmacological methods that are not contraindication in this sense. It is painless. Adverse effects are negligible and or very rare. And here we have some reference about the transcranial magnetic field stimulation, about the magnetic field stimulation. What I want to underline at the end of this presentation is that applying of these procedures need a very good assessment before applying. Is need not only to address to the indication, address to the first diagnostic, but it also need to take in consideration the advantages and the contraindication. It's now to know very well, it's better to know very well which is the associate pathology, because sometimes we need to apply this procedure for an chronic inflammatory problems with chronic pain, but it's possible to have some aspects that are like neoplasy, and so we generate the neoformation and many other severe problems of health. For this reason, is need to make a very good assessment and to decide after if it's an opportunity or not to use these procedures, and also to respect the rules and the principles about the duration, about number of sessions, and about the position. Thank you very much for your attention, and I hope that this course give you a few information about how to use magnetic stimulation.